Hello, everyone. Thank you so much for joining us for this evening's webinar. My name is Eric Childress. I'm the Client Services Manager here at JARALL Medical Management. Before we get started, there are a couple of housekeeping items I'd like to review with all of you. I will moderate a live Q&A at the end of this webinar. At any time during the presentation, please feel free to submit questions via the Q&A button, which should be at the top of your screen. Our speakers will address your questions during the live Q&A at the end. Also, this webinar will be recorded and emailed to all of you on Friday. With that, the topic of our webinar tonight is incorporating shockwave therapy into your practice. I'm joined by Dr. Alan Rosen, our presenter, and Dr. Alan Bass, CEO and founder of JARALL Medical Management. I will now hand things over to our founder. Dr. Bass.
Thanks, Eric. Dr. Rosen's having just a little bit of technical difficulty, so we're just waiting for him. He just had to log off and log back on, but I want to welcome everybody this evening to tonight's webinar. You know, what we try to do with our JARALL Quarterly webinars or just our monthly webinars is to provide education. What we try to do in this series of webinars is 1 month I will present something more clinical, maybe on documentation or something that I encounter a lot at JARALL Medical Management. The next month we will normally do something more administrative, where it will be directed more towards your staff, your front office staff, try to help improve their processes. Such as last month, we did one with insurance verifications and understanding how to deal with insurance. And this month, or on the third month, what we try to do is we do an industry webinar. And I've been very lucky throughout my 30 plus years of doing this that I have met some really great people, and I've come across some really great technology that practices would benefit from having, or physicians would benefit from having in their practice. I have known Dr. Rosen for many, many years, and when I was speaking with Zimmer, I said, "Can you find one of your doctors who you feel is an expert?" And he just happened to say Dr. Rosen's name, and I had known Dr. Rosen for many years, so I thought it was a natural thing for him to come on this evening. So I'm hoping that he'll get past these technical difficulties and we won't have to delay this webinar much longer. I apologize, as most of you will probably understand, what's a good webinar without some technical difficulties. But for those of you who are here, who are JARALL Medical Management clients, thank you for joining us this evening. For those of you who are joining us this evening who are not JARALL Medical Management clients, welcome. Found the JARALL Medical Management. Something to my audio, or can you still hear me, Eric? I'm sorry.
You just came back in.
I was playing with some AirPods, and I opened the case. I found the JARALL Medical Management because one of the things that I wanted to really do was be able to provide services back to clients and provide services back to podiatrists across the country. So if anybody who's on this evening has any questions about anything, please feel free to reach out to me directly. With that, I see that Dr. Rosen has gotten past his technical difficulties. So welcome, Dr. Rosen. I was just telling the attendees that when I was speaking with the company, with Zimmer, about having one of their experts come and speak with us this evening about incorporating Shockwave into your practice and the benefits of it, and they told me your name. I said, "Oh, I've known Dr. Rosen for many, many years." So I thought it was a natural thing for you to jump in and talk about that. So with that, I'm going to turn it over to Dr. Rosen, who practices here in the Northeast with me in New York, New Jersey. So you gotta a New York, New Jersey contingent going now. So I'm going to turn it over to him. I'm going to mute myself and go off camera, and Eric's going to control the slides for him so we can get past any technical difficulties. But Dr. Rosen, take it away.
Thank you very much. Good evening, everyone, and I want to thank Dr. Bass for having me tonight. We do go back a long way. So talking about this new technology of Shockwave, I am not very computer literate, and I have 3 computer screens open, and I am on my cell phone. So I don't know why I had so many technical difficulties, but I'm glad to be here tonight to talk to you about Shockwave. I was first introduced to extracorporeal shockwave therapy in the mid-2000s when it was first approved by the FDA for Achilles tendonitis and plantar fasciitis, and it was considered the new cure. During that time, doctors would have to bring the patient to the OR. They would have to go under IV sedation, and everyone in the OR had to wear headphones because the machine was so loud. I would then administer this huge machine that was like a jackhammer, and the benefit was that the system worked very well, and most patients got better after one treatment. It was like magic, but like everything else, there's an end. This was a very costly procedure for 15 to 30 minutes, and within a year or two, the insurance companies dropped it. So the fee for the service became very high because patients had to pay for the OR time, pay for the anesthesia, pay the doctor's fee, and it just really was, way too expensive for what patients wanted to spend, and most of them opted for traditional treatments. So approximately 5 to 6 years ago, at the New York Podiatry Conference, I met Paul Cummings, who is the Zimmer rep, a great guy. I learned about Shockwave treatment, and I was instantly ready to sign up, hopeful that would give me the same result as extracorporeal did. I was probably one of the first podiatrists in New York City to have a unit in their office. So now let's review Shockwave and how to bring it into your office and to provide the most beneficial treatment for your patients, as well as the benefit of added income to your practice. All right, so let's go to the next slide. I'm going to follow on my computer. So we're going to introduce concepts of Shockwave therapy, explain how it will benefit both your patients and your practice. We can go to the next slide, please. So the indications for Shockwave therapy, as I discussed right before, originally approved by the FDA in the mid-2000s for plantar fasciitis and Achilles tendonitis. Definitely works great for both of those. What shocked me the most was how good it worked on retrocalcaneal bursitis. As we all know, this is a very frustrating ailment for both patients and for doctors to treat. Many patients spend many months in physical therapy, cam walkers, strappings, NSAIDs, and to no avail. They still walk around in pain, or their pain comes right back. And I really have to say that the majority of patients will feel a lot better after 5 weeks, and usually by the end of 10 weeks, they're back to their normal selves. And to me, that was the biggest shock, because after 35 years of practice, it is definitely a tough one to treat. Of course, the peroneal tendonitis and medial tibial stress syndrome. I don't do a lot of wound care in my office, although it is something that can be used to increase vascularization of the wounds. About a year ago, I started treating it successfully for neuromas. I've definitely found some success in that. It's very good on sesamoiditis, another difficult thing to treat. Posterior tibial tendonitis, post-op pain and fibrosis. So for those patients who go on to surgery, sometimes, neuroma, you might get some adhesions and thickening between the metatarsal heads. I do a few treatments of Shockwave, and it breaks up those adhesions. And also very beneficial for plantar plate injuries. Also another thing that is difficult to treat in our practices, and really with great success. You can go to the next slide, please, Eric. Oh, I have to go to the next slide too. Okay, so this is what extracorporeal shockwave therapy was. As you can see, the doctor's holding the patient's foot onto what looks like the end of a football. It was a soft shelled gel about the size of a football, that was then attached to that very long arm, which was attached to a very large machine, and it had to be wheeled in. And it was, comical when this big machine would come in, and it would vibrate the whole room. But once again, it worked. You can go to the next slide. So we already talked about the drawbacks of the higher energy units, 30-minute treatments, very long. You needed a nerve block or IV sedation. There was definite downtime because the patient had to prepare to go to the OR and spend the whole day there. They did bring them into doctors' offices later on, but still, again, it was complicated, very big units, so it kind of fell by the wayside. Let's go to the next slide, please. So advantages of today's system, you don't need any kind of anesthesia. The procedure really is very well tolerated for most patients. Sometimes when you hit a bony prominence, like if you're treating the area around the navicular or even the retrocalcaneal bursal sac, it can be a little bit more uncomfortable. I do find that after maybe a minute, each treatment is about 5 minutes. They are 3,200 pulses. And after about a minute, it kind of numbs up and they can tolerate it. Sometimes I don't press down as hard when I'm at the bony prominences. Also, when you have the radial shockwave, which we'll see in a minute, you can kind of direct the pulse to the painful area or injured area, and the machine's not actually sitting and pulsating right on it, so it's a little bit more tolerable. There's no downtime for the patient. They get up and they leave. It's much more affordable for both the practice and for the patients. You go to the next one, Eric. Hold on, wait. So the therapeutic effects, it creates microtrauma, inflammatory response. It stimulates angiogenic growth factors, stimulates vascularization, increases blood flow, promotes tissue repair. This is kind of how I sell it, as a way to rejuvenate your injury, to strengthen your injury, whereas cortisone injections and NSAIDs aren't going to really promote tissue repair, regrowth of collagen, make things stronger, so you're less likely to injure them. You go to the next slide. These are the two types of modalities. The left is the focused, and if you look at it, it's got a very broad head on it. The right is the one that I have for the past 5 years, and it has a much narrower head. And we'll look at the focus, we'll look at the waveforms in the next slide. So once again, the left side was the white one that had a much wider base on it, and it's a focus system that penetrates the tissue into a focal point, like a cone, so you could pinpoint a specific area. The radial shockwave on the right has a much smaller head, which is that little black square on top, and you can see that the shockwaves disperse into a broader area within the tissue and radiate outwards. You go for the next slide. This is just kind of how the whole system works. A projectile is rapidly accelerated in the actually, before we end, look at the movie. You can see that pulsating. So that's the radial shock wave, and you can see the muscle pulse once it emits the wave. We do it at a much more rapid rate. It's like more like boom, 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 boom. But this is kind of showing you what it looks like. So it's a projectile is rapidly accelerated in the applicator, and the kinetic energy is transferred into the tissue in the form of a pressure wave. The shock wave continues to propagate in the radial fashion in the surrounding tissues. So it kind of creates a more broadband effect on the tissues. Next slide. So the shockwave is generated electromagnetically. The applicator produces a kinetic energy that transfers the energy to the treatment area in the form of a pulse. The average depth of penetration is 40 millimeters, which is much deeper than we need. If you kind of look at the picture, you can see the handheld on the mid-planar fascia, you can see that the wave penetrates outwards and upwards. So it really covers a wider area. Whereas we look at the next slide, we see that the focal shockwave, the applicator produces a piezoelectric shockwaves that deliver the energy into a treatment area. So you can see it really cones and is very specific for a specific spot. The average depth of penetration is 40 millimeters to 100 millimeters, 4 inches. I mean, you're going to be through the other side of the foot, so you're going to penetrate everything. So, either of these devices are great for everything we need in the foot. This device is specifically better for non-unions and stress fractures. I really haven't used Shockwave for that in my practice. So how do you incorporate shockwave therapy into your office? I feel it's our responsibility as doctors to present patients with as many treatment options as possible. Patients today are also looking for alternatives to traditional therapies like steroid injections, night splints, and physical therapy. They're on Google seeking out what practices offer that innovation. Many times, patients come to me because they heard about Shockwave, or they heard about some other treatment that I give, and that's how they'll end up in my practice. So if you do it, put it on your website. The search engines will go crazy when someone types in, radial shockwave or alternative treatments for plantar fasciitis. Patients will pay for non-covered treatments. Next slide. Because most insurance have a high out-of-network and high in-network, so they're used to kind of paying a little bit more. It's a little bit easier to get money out of patients these days because insurance does not cover everything, and everyone knows that the insurances are the bad guys. So we finally become the good guys. If you're sending patients out for physical therapy, the average copay is $50 a visit. If you do 12 visits that are allowed, that's $600 in an out-of-pocket payment. Shockwave therapy is a fraction of the time, so they're not spending, their hour in the physical therapy plus their time to commute back and forth to the physical therapy, and the cost is about the same. Most of my patients see that as a time-saving benefit. Here's a quick little analogy about podiatry and bakery. You can have a bakery in town that only makes bread. They have been there for 35 years and the bread is great. They have consistent customers that come every week and they are very happy. Another bakery in town opens up and they also make great bread. Competition. However, in this new bakery, they also make cakes, cookies, and muffins. So although bakery number one can provide the basics, what does one do when they need to get a birthday cake for their daughter? They go somewhere else. While they're there, they also decide to get a loaf of bread for tonight's dinner. The customer went somewhere else because they wanted or needed more than was offered, and many times they stay at that bakery or that podiatrist. So our practices, next slide, our practices are not that much different than a bakery. We need to offer what other practices aren't. That includes ancillary services like shockwave therapy. If not, they may go somewhere else that does. Next slide. The average charge for a package of 5 treatments is about $500 to $600. In New York City, it's a bit more. That is for 1 foot. There are other packages for 2 feet. Some people charge half, some people charge 3/4. When you're doing packaging for Shockwave, it's important for the patient to pay it all up at once. And the reason is because unlike other, someone goes to physical therapy that might feel the stretch, that might feel different. After shockwave, you don't always feel anything. You could feel the same pain, and it's a cumulative effect. And you need to have those 5 treatments to increase the vascularization, increase the amount of new tissue, and that takes time. So if patients are paying per treatment, and after the 3rd treatment, they still don't feel anything, they're less apt to go to the 4th or 5th treatment, which is what they need. If they pay ahead of time, they're coming to see you because they paid. You have their money, and it's a commitment that they make to you to follow through so that you can show them how beneficial this treatment is. So if you were to treat just 1 patient per week, that would be $2,400 in new monthly revenue. The monthly payment for radial shockwave is $379 or $799 for the focused. It's less than 1 patient per month. As long as you treat 1 patient, it doesn't really cost you anything. Next slide. So what's your return on investment? So if you were to treat 1 of each of these maladies per month with the radial system for plantar fasciitis, one patient with plantar fasciitis, one patient with Achilles tendonitis, one with retrocalcaneal bursitis, Morton's neuroma, diabetic neuropathy. And you get $500 from each of those patients. Your total monthly revenue is $2,500 minus what you pay for the radial shockwave. So it gives you a little bit more than $2,000 with a really yearly revenue of a little bit more than $25,000 and a revenue over 5 years of $127,000. The original system cost $18,000. So just to give you an idea of numbers of my office, I called my billing company before this podcast, and I asked them in 2025, last year, the entire year, how many new Shockwave patients did I have? So how many people started the treatment and paid for the treatment? And it was 92 new patient Shockwaves last year. So, you know, you can really utilize this many ways. Um, like I said, I present it like this. Someone comes in, they have plantar fasciitis, you know, explain the whole thing. I do a sonogram. I show them what their plantar fascia looks like, hypoechoic, it's thick, whatever. Here are your treatment options. I always start with a steroid shot because that's what they think they're coming in for. You can start with an injection. You can start with an NSAID. Those two things are anti-inflammatory. They bring the swelling and the tissue back down. You can do physical therapy. You'd have to go for 6 to 8 weeks, twice a week, and you might benefit from that. Or you could do something really different and cutting edge, and that's radial shockwave treatment. Oh, what is that, doc? Well, it's you come 5 treatments. It's like a jackhammer that I hammer on your heel for 5 minutes, and then you leave, and you don't feel any pain during the procedure. And in 5 weeks, you'll start to see a difference. What I normally do is I do a sonogram when they first come in. I do the 5 treatments once a week, and then I give them 5 weeks to recuperate, for the tissues to revascularize, for the tissues to lay down, for the tissues to get stronger. And then they come in and I do a follow-up sonogram, and 90% of the time, the plantar fascia is back to its normal appearance on the sonogram, and within a normal 3 to 4 millimeters in thickness. Patients don't like cortisone. A lot of them don't want to take another pill. They don't want to go to physical therapy. So they'll sign up for it. Some jump to it, but then the others are like, well, doc, I'm not spending $900. That's crazy. All right, let's try a shot. So we do a shot. They come back 3 weeks later. It's not so much better. Maybe I'm a little better. Do another shot. Come back 3 weeks later. Still not better. I go, well, in the back of my tricks in my pocket, I do have Shockwave. Now, is that $900 thing? I'm like, yep, that's that $900 thing. Nope, let's go to physical therapy. Come back from physical therapy, they still have plantar fasciitis. All right, doc, I'm ready. And I'm ready to pay the $900. And you might say, okay, I'm in New York City, I'm on the Upper East Side, everyone can afford it. I have patients in New York City from all walks of life, every economic background. And the bottom line is, if they know that there's something that can really help them, they'll pay for it because they're paying for other things that aren't working, or they're going out to dinner, or they're, all different kind of things. I don't really do a payment plan because I, once again, feel that you have to get the money up front so that they comply. The only way this works is if they do the 5 treatments. If they do the 5 treatments for plantar fasciitis, I can guarantee 90% of them will get better. And what happens if the ones that don't get better? So, you know what? I'm a good guy. I throw in 2 more treatments for free. I go, after the 5 weeks, we do the sonogram. I think you need to have more. Well, how much is that going to cost me? I go, you know what? It's on me. Let's do 2 more. Let's just add 2 more. And a lot of times, those 2 extra treatments does the job. If they start to need more than that, and I've had patients who have 8, 9, 10, then I charge, a nominal fee of $100 a visit for that. This is not covered by insurance. I tell them upfront, this is not a covered service. This is not something that I will submit. There was no code for it. And that's the way I work. And they have to understand that ahead of time because I'm not playing insurance games. This is what it is. It's a non-covered service, and that's it. So by and large, I am really happy with it because they do 5 treatments, and because I did 92 last year, I do Shockwave at least 3 times a day. because people might be on their third visit, their fourth visit, I might have a new patient. So the machine is always going. You go into the next room. Oh, what's that, doc? Oh, it's a Shockwave. What do you use it for? I have my brochures. It's an easy sell. And if you get the machine, or I should really say when you get the machine, because you really should buy it. I'm not, I have no participation in any monetary thing with Zimmer or any Shockwave. But the bottom line is, if you find a treatment that you could be successful in, why not have it? It's an affordable treatment. I mean, you're going to be in practice, you're going to use it. And once you see the benefit, it's the easiest sell in the world because you stand behind it, because you believe in it, because you see the benefit of it. So that's my spiel.
All right. Well, Alan, thank you. Thank you so much. Oh, look at that. I didn't even know that's what it was going to say. Thank you so much. One of the things, Alan, and I want to get your take on this. Well, first, let me ask Eric, do we have any questions for Dr. Rosen?
Yes, we have one. The question is, how does this differ clinically from laser therapy?
So I can tell you honestly, I don't do laser therapy. I was very happy with the Shockwave, and when I would go around the conferences, I felt like this is a modality that I used. It came out before laser therapy, so I've had it for 5 years. I find it very successful. There's only so many machines I need to keep in my office. So I couldn't tell you that. Maybe Dr. Bass has a better idea.
To be perfectly honest, I don't either. But let me ask you this, Alan. One of the things that I've always talked about is, empowering the patient and making sure they understand that, you're the expert. And well, I think that you said it perfectly. You gave them the options, but now, we're using this cutting edge technology now. Those are the things that patients want to see. Do you feel the same way?
100%. Yeah, everybody knows, the first thing that patients come in when they have the plantar fasciitis is like, my sister had a shot. It's just the worst thing in the world.
Right.
Well, we have alternatives. There are alternatives. I always say this, that I have the machine and every sports team has this machine. This keeps their players on the field. This limits their time away from their profession. So if sports teams have it, and I have it and I can offer it to you, this has got to be cutting edge.
Exactly. I mean, that's what it's about. I mean, and then that makes you the expert.
Right.
That makes you the expert. And one thing that I'll always say to my patients, and you probably feel the same way, is, when they hear that it's not an insurance-based treatment, that it's a cash-based service, I always use the word invest. They have to invest in their foot health. They have to invest in their health in general, whether it's investing their time if they want to go to physical therapy, or investing in, a pair of functional foot orthotics. They should invest in their foot health in the most cutting edge technologies that are out there. And I think that's what, Zimmer and Shockwave therapy does, because it's almost, there's multiple diagnoses that you could treat with, which really does put you on the cutting edge. And you always want to be the best. You want to be the doctor they go to.
Right. And they want to see all, I mean, I have pinpoint laser, I have the Swift, I have, all these other toys, and they see them and they're like, oh, wow, this doctor is, does everything that people don't. And that's the whole thing with the bakery, is it just a loaf of bread, or you're going to open your store and have all different things that people can enjoy?
Yeah. I mean, and then it's not just that one patient. It's like, that person goes home
100%.
to their friend who said, well, you got these shots, and now my doctor has now got the most cutting edge technology. But then it's that downstream effect that people then start to talk to everyone else.
Right. I mean, how many times do you have a patient who you're the third doctor? They come in with a bag of orthotics and a history of 5 shots a year and, things that are just unheard of, and they're still limping around. And then you do something, and because, once you see it work, I mean, that's the whole thing with me. I'm very truthful. I'm not going to get something that I don't believe in, and
Right.
I'm skeptical of. I believe in this product because I see the results over 5 years.
Right. That's what it's about. Doctors have to know that if they're going to invest in, just like you want your patient to invest in the service, you are going to invest your dollars in having a modality in your office. Well, you have to believe in it, and you've had it for so long, and your patients are deriving the benefit from it. That's really what it's all about.
Yeah, yeah, yeah. It's
Very
funny.
good.
I called my friend who's in Florida, podiatrist, and yeah, I had told him about Shockwave about 4 years ago, and he finally bought a machine last year. And I was like, he would only do it on plantar fasciitis. I was like, I don't know why you're only doing it on plantar fasciitis. It's good for retro. So finally, he did retrocalcaneal bursitis, which was amazed. And now he's doing it on plantar plate. So some people, have to feel comfortable, you know.
Of
Um,
course. You can't,
but
and
if you
I think you'll agree. You can't feel like you're selling anything. You have to believe in it.
no,
You have to have the
right,
person invest in it.
right, exactly, yeah,
That's really
yeah,
what it's about.
right. It's
Yeah.
not selling. You're offering. It sounds like we're salesmen, but we're offering modalities that other people don't offer. And unfortunately, I always say, if everything, they go, what would you do, doc? And I go, if everything was free, I would do Shockwave. That's the bottom line, because
Yeah.
that's what I would do.
I mean, I always say, you can't think of yourself as a salesman because let's be honest. And for everybody here, do you think dermatologists are afraid to ask their patients to invest in whatever in their practice, whether it's a cream, a lotion? Do you think dentists are afraid to ask people to invest in $300, electric sonic toothbrushes? They're not. They're offering
Right.
services to their patients, and we should do the same thing.
Yep. And
We
not be
have the
afraid.
opportunity to offer these cutting edge services.
Yeah, and not be afraid of it.
No,
I went to the dentist last year, and when he told me the price of what I needed to do in my mouth, I was like, well, there goes the bathroom remodeling. I mean, and without a flinch, they rattle off these numbers that are, multiple zeros. And I'm like,
yeah,
I'm trying to get $900 from a shop.
I
And so you can't
understand.
be embarrassed. You can't be embarrassed to ask for it.
No, not at all. Eric, any other questions from anyone else in the audience?
Yep, just had one more come in actually. Will a patient who gets Shockwave still need custom orthotics?
You know, I'm not the believer that every single person needs a custom orthotic. Okay, so I do a lot of custom orthotics, but depending upon the foot structure, sometimes they just need an device. They can get it over the counter, better than a Dr. Scholl, like a Power Step or some of the other ones. I always tell people, if you're not going to get a customized one, get something that's between $50 and $70. Don't come in with a sponge that you put under your foot.
Exactly.
And so just to prevent it from reoccurring. People are like, if I do the shockwave, is that it for life? I go, well, it's going to work, but if you step off the curb or you fall off a ladder, you can re-injure yourself like any other time.
Exactly. No, I believe that. Anyone else, Eric?
Nope, just those two, unless
All
anyone has
right.
anything else.
Well,
Right.
Alan, I want to thank you for your time this evening. It's all about, having doctors who show, like yourself, you have modalities in your practice that have made your practice successful. And you're the place where people want to go so they get the right treatment. So I want to thank you for sharing your experience with the audience tonight. If anybody
We had
will
one
have any
more.
other additional questions, when you get a recording of the webinar, you could always write into Eric. We could put you in touch with Dr. Rosen. And I want to thank you again, and I want to thank Zimmer for having you come to us this evening. And if there's no other questions, I guess we'll adjourn for the evening.
We do have one more that just popped in, Alan.
Oh,
I
look
want to
at
make sure we
that.
get that one.
Okay.
See,
Yep.
I talked long enough, and that's what happens.
Yep, that's what brings them in.
What was the
Any
question?
thoughts or insight on different high-priced devices, such as Softwave 30,000 or StemWave 75,000?
I don't have an answer
I
on
don't
that.
have any opinion on that. The only modality, other than this that I would recommend in my practice, and Alan mentioned he has it in his, is I was a user of Swift. plantar verruca. In my practice, I thought that was I got phenomenal results when I was still in practice using that.
It's a game changer. Definitely a
It
game
really
changer.
is. It really is. So if anybody's thinking about investing in any other modalities beyond number one being, Shockwave with Zimmer, then think number two with Swift. But before anything else, and Alan, I think you'll agree, have the patient base. If you don't see a lot of warts, don't invest in Swift. I saw a lot of pediatric patients with a lot of warts. I invested in it. It was great.
It makes sense. Yeah.
So,
I think that first of all, just talking a little bit about Zimmer, I think it's a great product. It's easy to use. They have great reps. They definitely have good service. If you need, help with anything, they're always there. If you have questions about, you can work on this, they have all the research. Paul is very, very knowledgeable and has been really, really great person to talk to throughout these 5 years. And also, I want to thank Alan. Thank you for inviting me. Thank you, Eric, for being the slide changer. Thank you, Paul, for inviting me as well. It was a really nice evening. Thank you.
Very good. All right. Well, thank you again, everybody. So have a great evening, and look for the next JARALL webinar will be next month, and Eric will be putting out a topic shortly, and we look forward to having you participate in that one as well. Thank you very much. Have a great evening, everyone.
Thanks.
Thanks. Bye-bye.